If you said D, all of the above for question 8, and B, percutaneous balloon valvuloplasty for question 9, you are correct. We will go into why later in this video. Valvular heart disease is heavily tested on board exams, often using auscultation findings. To confirm a diagnosis of valvular heart disease, most of the time you just do an echocardiogram. The sounds you hear from a murmur are caused by turbulence caused by increased flow through a narrowed or damaged lumen, indicating either a stenotic or regurgitant valve, depending on if the sound occurs in systole or diastole. All diastolic murmurs should be considered abnormal and need a workup. All systolic murmurs, grade 3 or above, need a workup, but some grade 1 or 2 systolic murmurs are benign and may not need investigation if there are no associated symptoms. Regurgitant and stenosis murmurs increase with anything that increases blood flow through the valve, like squatting and leg raising, and decrease with anything that decreases flow across the valve, like the Valsalva maneuver. Right-sided murmurs increase with inspiration, and left-sided murmurs increase with expiration. Decrescendo murmurs progressively increase in intensity. Crescendo-decrescendo murmurs have a progressive increase in intensity followed by a progressive decrease in intensity. The patient in our questions has mitral stenosis. The most common cause you will see on an exam is rheumatic fever. She likely had as a child, as she had emigrated from a resource-poor setting and may not have received treatment for streptococcal infection as a child. Symptoms are caused by backflow of blood from the left atrium into the lungs, causing dyspnea and other heart failure symptoms. The left atrium can become stretched, increasing the risk for AFib. Over the long term, mitral stenosis can lead to pulmonary hypertension and right-sided heart failure due to backup of blood. Occasionally, the left atrium can become so enlarged that it compresses the left recurrent laryngeal nerve, causing hoarseness. For mitral stenosis, on exam, you will hear an opening snap, followed by a decrescendo murmur in diastole, loudest at the apex. Patients may also have signs of heart failure, indicating that the mitral stenosis has progressed to causing right-sided heart failure and pulmonary congestion. On EKG, you'll most commonly see left atrial enlargement. On echo, you will see stenosis of the mitral valve, which you can use to assess the area of the valve and for the presence or absence of mitral regurgitation. The area of the valve and the presence of mitral regurgitation can influence the type of intervention someone may be a candidate for. Typical treatment, when indicated, is with balloon valvulotomy if there's no left atrial thrombus or mitral regurgitation found and the disease is severe. Click through to the next page to listen to the murmur of mitral stenosis, then let's do another question.